Good afternoon to everybody. Let me say that it's a great pleasure for me as President of European Brain Council to participate to this conference and to contribute to this important topic that is a better future of healthy aging, which in my opinion is representing one of the greatest challenge for our future in Europe and worldwide. And I'm particularly grateful to the organizers and particularly to the government of the Republic of Croatia to give all of us the possibility to share thought about this great challenge for our future. But let me at first briefly introduce all of you to the European Brain Council, which is an umbrella organization that merges and brings at the same table all the major stakeholders in Europe that have an interest on the brain. It has been funded already in 2002, bringing together the basic scientists, the Federation of European Neuroscience Society, International Brain Research Organization, together with all the major European Society for Clinical Science, ECMP, the European Association for Neurological Society, European Psychiatric Association, the European Association for Neurosurgical Society. But what more important is to my eyes is bringing also together patients' organization like the Federation of Neurological Association and the Global Alliance for Mental Illness Advocacy Network, GAMIAN. And this is also together with a number of associate members and observers, representative of the member state and national brain council, which brings us the flavor of the relevance of brain research in the different countries and representative from the private sector. And this important table has been funded, as I told you at the beginning already in 2002, with the major goal to speak with one voice to advocate for brain research, with a core mission to promote brain research and brain health in order to improve prevention, diagnosis, therapy and care, and improve also the quality of all the citizens that are living with the brain disorders in Europe and possibly bringing out and reaching out at the international level with our example and our action. And our main action area were basically focused on advocacy for brain research, that is fostering the cooperation with the member organization, with all the major stakeholders in Europe that I shown you before, promoting dialogue between scientists, clinicians, patients, industry and societies, raising awareness and promoting the education on the brain and on brain diseases, disseminating information that we collect on our internal project about brain research and brain diseases in Europe, and we were going to talk briefly about that later on, and interacting with the European Commission, the European Parliament, and other relevant international institutions to clearly advocate for our discipline and to raise the awareness on the importance of the challenge that is posed by brain diseases in Europe and worldwide. And particularly this last part, to advocate towards the institution, is one of the key pillars of our action, and we take it extremely serious. We are particularly active in bringing all the ideas and the needs of our community towards the European institution, as you could pick from this picture that is representing our presence in the different European institutions, the Parliament and the Commission. And last in time, but certainly one of the most important action that we took lately was the meeting with the new commissioner Gabriel to discuss and share ideas how we can put actions to respond to the challenge that is posed by the increasing number of brain diseases in Europe, also due to an aging population. And in the frame of advocacy and a better coordination of European research towards this important challenge, I wish to share with you very briefly one of the most important projects EBC is involved with a number of partners, including all the large initiatives funding brain research in Europe, JPND, Eranet Neuron, Human Brain Project. EBC is coordinating this important project that is called European Brain Research Area, or EBRA, as you may find in the webpage, I'm sure, in many highlights around the European communication. And this project was designed, and it is now funded by the European Commission, exactly to reach a better coordination of brain research across Europe, while also looking at a global initiative with key goals and key issues to be addressed, like the avoiding the fragmentation of the funding on the different resources to create a better connection, to identify gaps or areas that are primarily underfunded in our discipline in brain research, but also to identify shared priorities. This is a big effort that EBC is taking in these days, and I really hope that we can bring good results in the future to the whole member states. As I alluded to you before, we are really facing a challenge that is posed by brain diseases, which is what I call a timely challenge or even an emergency. And in these days, we are really talking a lot about emergency. A recent study of a European Brain Council, in fact, depicted the number of this challenge. And we clearly defined that the cost of brain diseases in Europe estimate at 800 billion euros. And what is even more striking to my eyes is that we have been able to show that it's not only the cost, but let me say that it's the number of citizens that are living with brain diseases, which is really astonishing, because we have been able to show that one of those 3 European citizens are living or will experience or are experiencing a brain disease in their life. This number, 800 billion euros and 179 million of European citizens, just give us the proportion of the challenge which is out there. And very recently, only 3 years ago, WHO confirmed this fear and this threat or this challenge, because it has been clearly posed by WHO in Europe that mental and neurological disorders are responsible for the biggest number of years lost due to disability in Europe, in all our member states. And this is again an incredibly high challenge to be faced and to be confronted with. And the impact of brain disorders extend well beyond healthcare system. It's not only the high cost for the healthcare, but it's the high cost for technological progress, the loss of healthy life years and the quality of life, the pressure on health and social welfare system, the implication from labor markets with prolonged impairment, the great dependency, and the significant reduced productivity in our countries. And these numbers that I've shown to you, we all know, are set to grow because the European population is aging. And in many brain diseases, like neurodegenerative diseases that will be the topic of this conference and will be highlighted in this conference, the numbers are incredibly increasing because these diseases are more common when people get older. And this is typically the case of Alzheimer's disease, that again will be one of the main topic of this conference. And I simply would like to show again some data that has been produced by the European Brain Council, in which we have been able also to show the ranking of the major costly brain diseases in Europe. So we identify 12 brain diseases that are here depicted. These are the number of subjects affected. This is the cost per subject, and this is the total cost at Europe of these diseases. In these 12 brain diseases, you can see that dementia is highly represented, and in fact it ranks at the second position in this incredible ranking, so between the most costly brain disorders. The first was the mood disorders, as we will know, that is impacting very strongly on the productivity of our member states. So the case of Alzheimer's disease is particularly interesting to my eyes, and it is also close to my research field. We know that with a rapidly aging population, Alzheimer's disease is a growing public health concern worldwide. In Europe, we estimated at the moment about 10, 11 million of people affected by dementia, and 70% of these cases are Alzheimer's disease, as we know. And these numbers is expected to increase or to double in 2015, again, due to the aging of the population and the life expectancy. And it progresses with stages, beginning with a long silent phase before the symptoms appear, and maybe it is time to focus in the very early stages to prove that we can identify finally a disease-modifying therapy. And particularly Alzheimer's disease was one of the focus of a recent a project of European Brain Council, that is the value of treatment. In this particular project, we wanted to provide policy recommendation on how to provide optimal care in the disease area under study by addressing some treatment gaps with specific objectives. One of the objectives was to identify current treatment gaps and patient needs along the care pathway and the patient journey, and analyze the underlying cause or identify and propose solution to addressing them. To evaluate the cost and the burden associated with treatment gaps and the socioeconomic gap of closing or reducing them by applying some solutions or identifying new cure or new procedures, and therefore to propose policy recommendation on how to improve the care pathway. And we address this at the moment on sort of 12 case studies. One of those, as I mentioned, was Alzheimer's disease. And the aim of the value treatment study on Alzheimer's disease was primarily to examine, as I told you, health gains and socioeconomic impacts resulting from an hypothetical model of intervention in which finally a disease-modifying treatment for AD in comparison with the current care or with no treatment, that is most of the situation we are confronting with at the moment, and to converge data evidence to policy recommendation. These are the recommendations that we came up with. And the first was really to focus, as I alluded to you before, on the very early phases of the disease to reach an early diagnosis. So the first recommendation was the urgency to understand first and to recognize after the early stages of AD as part of a continuum of the dementia process, and to ensure a rapid diagnosis with opportunity for intervention. To increase awareness of understanding of early stages of AD, the burden of the disease, and the opportunity to change the trajectory of the disease with an active early intervention, including innovative therapies. And first, of course, to address the stigma and the fear of the disease and encourage the patients and the carers to get an early diagnosis and to immediately refer to the GP or to the doctor. And overall, and this is a strong message I would like to pose, to support and promote dementia research, to improve diagnostic, to speed up the developing of finally maybe disease-modifying therapy, with or without pharma. The results and the impact of such a behavior and such an investment could be incredibly effective. It's not only effective on the cost, is effective on the burden of the disease. We know that the preventive therapy can delay the onset of Alzheimer's disease symptoms by 3.5 years, which would reduce Alzheimer's disease prevalence by 1/3. This is particularly effective results. And we also know, and we described in the VOT study, that a putative drug that can be a disease-modifying drug could delay the progression of the disease and can diminish the cost that at the moment is set per patient per year at 22,000 euro to 12,000 euros, which is an enormous sparing of the cost of the disease for the health system. Early detection and treatment delays the progression by 3 years almost, which usually will also strongly reduce or eliminate the need of institutionalization of Alzheimer's patients. And last but certainly not least for the carers and for the families, delaying the onset and the progression of Alzheimer's disease gives affected person 6 more years of good quality life without extending the life expectancy. And this is tremendously important for the carers. So we are in front of a challenge, but I have to say that in these days, we learn how to react to a challenge or to an emergency, because Europe has been bombarded or exploded in this emergency of the new virus, COVID-19. And COVID-19 certainly has shown us that research funding is crucial for our society. But we need to learn some lessons out of it and to expand what we learn from COVID-19 to what I consider a true emergency for Europe and worldwide, which are brain diseases. In fact, we need to know that on a daily basis, non-infectious diseases remain equally as misunderstood as virus like COVID-19 and have an urgency on their own